Hi, and welcome to today's topic of discussion. Today we're going to be looking at the coronavirus. Of course, right? What else were we going to talk about today? This is the topic which has literally entered into every other household, if not every single household, around the whole world, across all the different continents. The coronavirus. I wanted to, however, look at it from a different perspective, a different angle. I wanted to look at how three distinctively different countries are dealing and fighting with the virus, and which one is proving or proven to be the most successful. Because, as we'll see, some of them are still in the process of their fight. So it's yet, it's inconclusive as to how successful they are as of today, right now. Right, okay. So basically today we're going to be looking at how the coronavirus is being fought, and Italy, the UK and Singapore will be our focus. So first of all, we're going to be looking at some of the problems that the coronavirus is posing to us. And here I just wanted to highlight some keywords, to be fair, as opposed to the problems. I think some of these are related to problems directly. Some of these are more keywords that we'll need to know before we go into our discussion today. The first word, pandemic. The World Health Organization, right? On March the 11th, they announced that the coronavirus is a pandemic. This comes after they initially hesitated to declare it as a pandemic. Why did they hesitate? They hesitated because they claimed that they do not want to use the word pandemic carelessly. Why don't they want to use it carelessly? Because they don't want to scare the people. They don't want to instill fear in the people. And this is why they didn't want to call it a pandemic. Anyway, in the end, they have declared it to be a pandemic. So what exactly is a pandemic? A pandemic is a disease that spreads across the world, across the different continents. Now, yeah, of course, the coronavirus is a pandemic, and now it's officially a pandemic as well, as declared by the World Health Organization. Now, let's talk about the positives of this first. The positive is that in comparison to other pandemics, the fatalities are relatively low, and also the fatalities are, let's say, predictable. What do I mean by that? If you are under a certain age, I think the age flying around is around 60 or 70. If you're under that age and you don't have any underlying health conditions, then it is unlikely that this virus will prove fatal for you. So that's the good news, right? However, of course, if you are above that age, or if you have any underlying health conditions, then the coronavirus can be fatal. So what's causing the chaos, and what's causing the panic, and what's causing the fear? It's the fact that the coronavirus is a contagion. It's a contagion. What does a contagion mean? A contagion is something that you can get from someone else or something else, right? It is contagious. It spreads. That's the danger, and that's what's causing chaos. That the coronavirus is a contagion. It is very contagious, and you can get it by touching something or someone that has been touched by someone that has or had the coronavirus. And therefore it spreads very easily. And unfortunately, one doesn't know if they've had the coronavirus until sometimes, it can take up to 14 days till you find out you actually have coronavirus. And by then you've probably given it to numerous other people. So that's the reason why this is probably a pandemic, and it's causing so much chaos around the world. Initially, how did countries react, especially at the airports and people coming out of China? Because, I mean, as you know, this is a disease or a virus that originated from China, Wuhan in China. So how was it dealt with initially? People were put into quarantine. So quarantine means being put in a confined area or a building where you cannot leave, no one can enter, and you're put there for 14 days until you are clean, and then so just to prevent others from getting it and to also prevent you from spreading it. What are some approaches that countries have taken? This is what we'll be looking at, right? This is what we'll be looking at. So a problem from our perspective, from the people's perspective, is a lockdown, for example. An approach by many countries, is the approach of a lockdown, right? Locking the whole country down. A lockdown is where your country shuts. Everything halts, everything stops. You cannot come out of your house unless there is an urgent need, unless it is essential. And there are members of the army outside to prevent you from doing that. That's a lockdown. So it's serious. And anyone under the age of 30, hasn't experienced this for living in the Western world, especially. So this is definitely problematic, and abiding by it can also be problematic. Self-isolation is, and lockdown, we'll be looking at that when we discuss a particular country and how they're dealing with it. Self-isolation we'll also discuss when we look at one of the countries. Self-isolation is when you yourself lock yourself down in your house. So if you show symptoms, then you isolating yourself away from others. That's basically self-isolation, and that's the difference between self-isolation and a lockdown. Hoarding. What's hoarding? Hoarding is when you stockpile. When you go to the stores and you buy a lot of something and you pile it away, you save it for a rainy day. This becomes problematic when you're buying a lot more than you need, when you are preparing for 6 months, 12 months, 18 months. This is a problem because this has a knock-on effect on businesses. This has a knock-on effect on your neighbors. This has a knock-on effect on your community, because if you've taken everything from the stores, then what about your neighbors? What about your community members? I mean, it just causes a lot more chaos. And this is one of the rotten fruits of panic buying, right? And we are seeing this in some parts of the world, not all parts of the world. Some parts of the world, people are panic buying, where they're going into stores fearing that the country will lock down soon and they won't be allowed out. So they are buying and hoarding food and stockpiling food so that they are prepared for, a long time. Right, okay. Is it a global problem? I mean, it's a global problem, right? These are the numbers of confirmed cases that have spread outside of China, outside of the original place of the coronavirus. And from what I recall, in China alone, it's around 80,000 as of today. So these numbers you see here, this is outside of China. Yep. So if anyone's still denying that this is a problem, then I mean it's we have to admit it is a problem. I think I read today the Kenyan president or prime minister said it's a hoax, or someone high up in Kenya said it's a hoax. And I think he's lost his job, or he's no longer in his role. Anyway, it's definitely real. It's definitely real. It's a pandemic, and it is definitely a valid cause for concern. Right, okay. So let's have a look at these three countries then. The first country we're going to start off with is none other than Italy. Why do I want to start off with Italy? Because Italy is an interesting one. Italy is an interesting one. What's happening there, what's happening all over the world is, of course, is unfortunate, right? However, why do I say Italy is interesting? Because I'm sure you've seen in the news recently that the number of deaths in Italy, as of yesterday, the 19th of March, has gone beyond those in China, where the virus originated. Now that is startling. That is startling. It is, yeah. I mean, I am lost for words. Italy is a tiny country, and the number of deaths there is crazy. Is crazy how it has surpassed that of China. And some of the images and videos that are coming out of Italy right now, it doesn't look like a very pretty place right now. Right, okay, so that's the problem in Italy, right? What are they doing? What are they doing? They are basically employing the complete lockdown approach. They have locked down their country. I think on the 8th of March, they locked down the northern part of Italy, where the most cases were to be found. And then the very next day, the whole of Italy was locked down, and this was enforced with force, where members of the army were employed to ensure that people do not leave their houses unless there is an essential need, such as work, health, and emergency. And work, of course, this is work where work that cannot be done from home. What they've done during this lockdown, schools are closed, universities are closed, gyms, cinemas, museums, bars, restaurants, everything is closed. Everything is closed. All shops are closed except for those that would suffice your essential needs, such as groceries, pharmacies, and banks. As you're probably aware, sporting events, this is the country where initially the sporting events started to stop. Serie A was games were being cancelled here first before it hit other parts of the world like La Liga in Spain and Premier League in the UK. So it's definitely a major problem, and this is how they are dealing with it. One of the reports was saying that in hindsight, what they've discovered is a problem in their approach was their hospitals were clogging up. They didn't prevent those that aren't showing symptoms from entering their hospitals. This allowed, and unfortunately, this obviously heightened the issue, and it didn't make it easier upon them or the people. And now, people are being treated all over the hospital. Waiting rooms have turned into rooms where patients are being treated. The coronavirus patients are getting plastic helmets over their heads. Some very grim sights are coming out of Italy right now. However, the experts over there, the health experts, the politicians, they are all urging the rest of Europe that you need to do the same. You need to lock down your countries. France, Spain, England, the UK, you need to lock down your countries. Otherwise, you are next. You are next. They say that Italy is about 4 weeks ahead. So the videos and the images that are coming out of Italy, this will be England next. This will be France next. This will be Spain next. Germany next. So they are urging other European countries to follow them, and lock down their countries by force. Right, let's have a look at the timeline of Italy then. Their first. Now this is quite mind blowing. The first case that was reported was the 31st of January. Actually, the same as the UK, the same date. And then 20 odd days had passed. 20th of February, only 3 cases, only 2 more cases in those 20 days. Nothing to be alarmed about. However, 1 month later, as of today, there are 47,021 cases confirmed in Italy. There are, and it is said that over this past week, 20,000 cases were reported. This is the unfortunate situation in Italy right now. This has been quite often compared to South Korea's approach. After China, a few countries saw a spark and a surge in their reported cases. They were South Korea, Italy, and Iran. Right? We can see, I've just shown you what's happening in Italy, not looking very good. South Korea, however, right? They dealt with it pretty well. So this is why Italy and South Korea get compared quite often. South Korea, what they did was they focused on testing the people. So they had drive-by tests. They focused on testing as many people as they could, and this helped them, as we can see, right? This helped them control their numbers, control the number of people dying there as well. But anyway, South Korea isn't our topic of evaluation today. So let's have a look at the second country, and this is my country. So I have an invested interest in this, the United Kingdom. Right. What's the problem here? The problem here is literally in the past 2 weeks. The numbers have gone from about 11, right? From about 11 to 3,269. On a daily basis, there is a sharp increase, as you can see from this graph over here. The numbers are going up very high on a daily basis. And this is one of the countries that is supposedly 4 weeks behind Italy. We're going to be like Italy in 4 weeks' time, supposedly. The health experts, they are saying if we get 20,000 deaths only, that would be a good number. They are predicting 500,000 people dying. So if that's the number of people dying, then imagine how many people would be affected. So it's something to be worried about. So what's been their approach? Their approach has been quite interesting, and it's still ongoing. The claim has always been that we want to make the right move at the right time. We don't want to rush into making any rash or wrong decisions. And the Prime Minister, Boris Johnson, has always claimed, and is still claiming, that all his decisions are based on science and experts, and advice from science experts and medical experts. So, for example, he didn't want to shut down the schools early on as the number of cases drastically rised. He didn't want to shut down the schools or make any drastic decisions. He let everything go. Why? Because the concept of shutting down the schools actually doesn't, according to his experts that he's relying on, it doesn't help in reducing the number of cases. It does not help in reducing the number of cases, and schools are apparently a safe place to be in for the children. Also, there's going to be a knock-on effect on the economy and the parents and the working parents, and so it's shutting down schools was always going to be a last resort. So he didn't want to jump into that like other countries. He didn't want to lock down the country like other countries. So he's come on TV every single day to give us updates, and we have received updates on a daily basis. Different strategies on how to deal with this, and I'm sure over the coming days we'll find out more as well. So as of today, 20th of March, everything is closed now. Today, literally today. Schools, universities, restaurants, cafes, entertainment places, all of these places have been told to shut down as of today. Unfortunately, they were still going until today, and only last night we saw people partying in the pubs and bars. But anyway, as of today, all of that is shut. The school exams will not go ahead this year, and I think teachers will be giving the students predicted grades. However, some kids will still be going to school. Those will be the kids of key workers. So key workers are still being told to come to work, such as nurses and health people in the health industry. These people are being told to come into work, and therefore their children will still be going to school. The initial advice before all of this was social distancing. Social distancing is basically keeping a distance between you. You're keeping a distance, basically. So do not touch anyone unnecessarily. And when you queue up at a bank or a supermarket, keep a nice distance. If you're going for a jog outside, again, keep a distance. I think they say about 2 meters. Also, self-isolation was advised and still is advised. Self-isolation is if you have any symptoms of the coronavirus, such as breathing difficulties or flu-like symptoms, then you stay at home for 7 days. You stay at home for 7 days if you have any of the symptoms. Also, your family members in that household, they should also stay at home for 7 days. Sorry. Your family members should stay at home for 14 days if one person in the family is showing symptoms. Those numbers I might be getting wrong, so please do double check them. But I might be getting them mixed up on who stays for 7 days, who stays for 14 days. Anyway, that's self-isolation, staying at home for a certain number of days because you show symptoms. Right. Okay. So the government's also decided to make unprecedented moves today in terms of helping out businesses, helping out individuals who may be out of work by promising to pay 80% of their wages. 80% of their wages. That should say wages there and not their taxes. So their taxes are being, the wages are being paid for, 80% of it, by the government. So this will stop businesses from getting rid of their employees. And this will help individuals to survive, I guess, during this difficult period of time. Right, the timeline in the UK, 31st January, the first case was reported. Then the 3rd of March is when roughly the surge started. That's when the number of cases was rising rapidly per day. Every day there would be at least more than double of the previous day. And then as of today, we have 3,983 cases. And if I remember correctly, 147 deaths. And as of today, the schools are shut as of today for an indefinite period of time. Right, so that's the approach taken in the UK. As you can see, it's a bit of a let's take every day as it comes kind of approach, right? Whereas the Italian approach was very direct, trying to deal with it in a direct manner. The Great British approach has been, let's see what the new day brings kind of approach. And the idea here is that more people get it, now so that they become immune, and then in the long run the UK will be back up and running before the other nations. That was the initial idea. That was the initial claim of the science that backed it. Right, okay. The final country that I wanted to look at, and this is a very unique approach, is Singapore. Why Singapore? Singapore was actually the first country, or one of the first countries to report the coronavirus after China. And it started, and as I'll show you in the timeline slide how it started and where it started from. But the problem here is that it started there. It was one of the first countries to report it, and there were 243 cases and 5,711 close contacts of confirmed cases that were traced. So this is a snapshot of the situation in Singapore. Right, okay, so let's have a look at their very unique approach. Their approach is, detective work is the word, right? What they've done is something called contact tracing. They've taken a 6-step approach. Number 1, the positive virus case. So when someone's test comes back positive and it's confirmed that they have the virus, this is when the contact tracing starts. Then what happens is they get interviewed, right? They get interviewed and their close contacts get interviewed, trying to identify where they've been, who they've been in contact with. Then the third step is to verify the information. This includes looking at receipts of places they've been to, people they may have been in contact with, and then those people also get contacted. Then what happens is close contacts get identified, and then those people get interviewed, their information is verified, and then if they've been in contact with other people, they also get contacted. And then there's the quarantine stage where close contacts go into a quarantine for a certain period of time. Again, it's 14 days from what I remember, but please do verify that information. And also number 6 is that they get monitored, that they are actually sticking to the regulations. There's a report of a British yoga teacher out in Singapore receiving a random call from a random number one day, asking her to confirm that she had used a particular taxi at this particular time and for this particular period, and she affirmed she was there, and she was surprised, she was shocked at receiving the phone call, and then she was told that she will have to quarantine herself and stay indoors at home for 14 days, and then she was obviously shocked at that period of time. She didn't know what was going on. The following day, someone knocks at her door and gives her a contract to sign, in which she confirms that she will quarantine herself for 14 days. She will not come out, otherwise she will face a fine and jail time. She obviously obliged. 14 days passed, and she didn't actually have the coronavirus. But this is the work that they're doing in Singapore. And this is what they've done to control the number of cases. As I mentioned, only 243 as of the 16th of March. I know today, the 20th of March, there were 100 odd new cases that have arisen. But as of the 16th of March, only 243 cases were identified through this detective work. How did they do it? CCTV, actual detective work, calling people, calling contacts, calling the people that have been affected and their close contacts, and using this 6-step approach. Genius, if you ask me. Why is it genius? Because look, mid-January, 20 Chinese tourists travel to Singapore, right? And it is confirmed that they left behind traces of the coronavirus. 20 Chinese tourists, mid-January. Note, this is before Italy and the UK. This is before Italy and the UK. And then come 4th of February, the Singapore government, they announced that the virus had spread into the local community as well. So, and they were saying that if we didn't take this approach, this contact tracing approach, we would have been the next Wuhan. We would have been the next Wuhan, the epicenter, the origin of the virus. That's how bad it would have been. However, they took this approach. 4th of February, the virus has spread into the local community. Come 16th of March, 4 days ago, only 243 confirmed cases in Singapore. Only 243. And no deaths. 243. Wow. I don't have any words. Wow. Right. So anyway, what did we do today? We looked at how 3 different countries are approaching and fighting the coronavirus. Three distinctively different approaches, and there are many other countries taking various different approaches, focusing on different aspects of tackling this virus. As I mentioned, South Korea, they're focusing on early testing. Dubai, for example, are focusing on cleaning, so they're cleaning all public transport, all schools regularly on a daily basis. They're cleaning everything that they think people will touch. They're doing that. Please do visit our blog, where you'll find a blog post on how Dubai are dealing with the coronavirus out there. But yeah, today we looked at these 3 countries, how they're dealing with it. I'd like to hear your thoughts. What do you think about these 3 approaches? Which one do you think is the best approach? And how is your country dealing with the coronavirus? And of course, does anyone have any ideas on how the coronavirus should be dealt with and fought? It's such a time of confusion where we're looking for some surety, some calmness, and it's a difficult time. So remember to stay safe. Remember to continue praying to the one who created us all. Verily, we believe that diseases are given by Him, our Lord, and cures also come from Him. So this is a time that we reflect over our purpose of being here. We reflect over how something invisible that He has given, and it has put the whole world into chaos, and no one knows how to deal with it. No one knows how to fight it, and no one knows how to remove it. So do reflect over this. Do reflect over how all of this has come about. And until then, take care, stay safe, and don't forget to let me know in the comments below how your country is fighting the coronavirus. Bye.